Hi, I'm Dr. Gretchen Kubacky, and I'm a licensed clinical psychologist in private practice on the west side of Los Angeles. I think everyone comes into my practice with some sort of relationship problem. The cause, because of my specialty being infertility, is probably about a third of the time infertility. I also work extensively with people who have grief and loss issues, and I do a lot of group work for people who have grief issues. And then I also have a very large group of clients who have some sort of trauma experience in their past, and that's contributing to things not working out so well in their relationships. My infertility practice arose out of my own infertility experience. So I'm not only a professional in infertility, I'm also a patient in infertility. And I have dealt extensively with chronic health issues and terminal health issues throughout my life. And so I combine the personal and the professional and practical expertise. And that, I think, is what makes me unique in dealing with these situations. My undergraduate degree is in studio art. So I'm a painter by training. And although I'm not a registered art therapist, I have done a lot of work with children and adolescents, and also with adults utilizing art. So getting at pre-verbal experiences, and I also use writing therapy and poetry therapy, as well as walking therapy. When I'm working with my clients, I always let the client guide the therapy in terms of the content and pointing me in the direction of the problem that you would want to be working on at that point. But depending on your needs, I may be more or less directive. Sometimes if I'm working with a grief issue, it's more important to just talk about the story. But other times, if there's something going on maybe that's unsafe or unhealthy, I will be very directive about how to handle it. So it really is depending on what is going on. I know that what I do works really well. I think there's a lot of great therapists out there, and what you have to do is choose the one that you're comfortable with and who seems like somebody who's really accessible to you and that you are going to be able to tell your problems to. And I also think that when you come to therapy, you need to be as committed to the therapeutic process as I am, and I'm very committed to it.